I'm a pediatric hematologist-oncologist at the University Hospital, Children's Hospital in Basel, and one of my topic is fertility preservation in patients with malignant and non-malignant disease. And I had the opportunity to spend 6 months in Paris together with Catherine Poirot. She's the pioneer for the cryopreservation of ovarian tissue in France. And we had the idea together to analyze the tissue, the ovarian tissue of sickle cell patients to see if hydroxyurea or hydroxycarbamide has really an impact on the ovarian reserve, because in the daily business we didn't have this impression. And we looked before to the literature, and there were some studies who showed indirectly, measuring the anti-Müllerian hormone, that the ovarian reserve in sickle cell patients who were under hydroxyurea should have a lower ovarian reserve. And so we decided to go to the tissue bank in France, and we analyzed the tissue of 76 patients. So 41 were not under hydroxyurea and 35 were exposed to hydroxyurea. And then we compared, we looked if the applied dose of hydroxyurea, the duration of exposure, did have an impact on the tissue. So we analyzed all follicle stage on the tissue, me and Catherine Poirot independently, and then we compared with all variables of each patient. And at the end, we couldn't see a significant difference concerning the primordial follicle, which represent the ovarian reserve. So the key message of the study, I think it's that you can reassure your patients that the hydroxycarbamide, hydroxyurea doesn't affect the ovarian reserve, because this is one of the major issues or the concerns of patients, so that they don't take it and they have a bad compliance. And on the other hand, you don't need to perform fertility preservation before you will expose to hydroxycarbamide. But you have to think about fertility preservation, fertility counseling, if you go into stem cell transplantation.